Welcome everyone to this deep dive explainer. Today, we're mapping out the 15 core medical vocabulary words you absolutely need to master for the CELPIP exam. But look, we're not just going to memorize a boring list, right? We're going to look at these words through the lens of an actual patient's journey right here in Canada. This cultural context is exactly what's going to boost your score.
All right, let's just dive right into our roadmap. We're moving through 3 stages today: symptoms and sensations, medical treatments and pathogens, and finally, body functions and health.
Section 1, Symptoms and Sensations, the discomfort. We're starting our journey right at the beginning. You know, that visceral experience of feeling unwell, and how to accurately describe those physical sensations to others.
So here are our first 5 essential words, and we've ranked them out of 5 stars based on how critical they are for your CELPIP prep. We've got a real mix of heavy hitters here, so let's break them down one by one.
First up is a massive 5-star term, chronic. Now, what's crucial to understand about this word in the Canadian cultural context is the reality of a free public healthcare system. Sometimes waiting to see a specialist can take a while. Because of that, chronic diseases and chronic pain are huge everyday societal topics that you're definitely going to encounter in the exam's reading and listening sections. And that perfectly sets up the contrast with our next 4-star word, which is acute. On one hand, you have those long-term chronic issues, but on the other, you have acute problems. An acute issue is sudden, it's severe, like an acute stomach ache. If you have an acute problem in Canada, you aren't waiting for a specialist, you're heading straight to a hospital's acute care unit. Let's look at how you'd actually use this. Saying something like, "I deeply apologize, but I won't be able to attend the conference due to a flare-up of my chronic back pain," smoothly transitions your vocabulary right into a professional context for your CELPIP Speaking Task 6, which asks you to deal with a difficult situation. It's polite, it's serious, and it uses really high-level phrasing. Now let's see how this builds into our next scenario. Imagine you have to write a municipal complaint for your exam. Canadian cities take community hygiene and waste sorting very seriously. So how do you describe a trash problem without sounding, well, basic? You use our next 4-star word, nauseating. Instead of just saying a garbage bin smells disgusting or very bad, writing about a nauseating smell from a dumpster in your CELPIP writing task 1 is going to immediately elevate your score. It shows a much stronger command of descriptive English. Moving right along, we have insomnia, a solid 3-star noun meaning habitual sleeplessness. Now, Canadian workplace culture places a really heavy emphasis on stress management and mental well-being. So when you're explaining fatigue to a Canadian boss or colleague in a role-play task, citing severe insomnia shows you understand this cultural nuance way better than just saying you couldn't sleep. It immediately commands empathy and respect. The crucial point here is that whether you're dealing with chronic pain, an acute injury, or just sheer exhaustion from insomnia, when you finally arrive at a Canadian ER triage desk, the very first thing the nurse will check is your pulse. This 3-star word is basic, but it is absolutely essential for understanding medical listening scenarios. All right, Section 2, Medical Treatments and Pathogens, the clinic. We've experienced the symptoms, and now we're navigating the clinical environment, getting medical intervention and figuring out the pathogens that are actually making us sick. We kick things off with a foundational 5-star word, medical. I know, it seems simple, but its application is incredibly powerful. Stating that you have a medical emergency is literally the most unarguable and respected reason for taking a leave of absence in a Canadian workplace or school setting. Honestly, I highly recommend you just memorize this exact sentence structure. I have an unexpected medical situation at home and need to reschedule our meeting. It's a polite, authoritative way to handle a scheduling conflict in your speaking or writing tasks. You're providing a totally valid excuse without oversharing personal details. Now notice how these 3 deeply related terms cluster together: infection, bacteria, and antibiotics. In Canada, if you get a bacterial infection, you're likely going to visit a walk-in clinic. The country has incredibly strict food safety laws to prevent harmful bacteria. But if you do fall ill, Canadian doctors are super strict about not giving you oral antibiotics unless that bacterial infection is absolutely confirmed. This whole sequence of events is a highly frequent scenario in the CELPIP's listening test. Our next word is cancer. While it's obviously a very serious illness, in the specific context of the exam, you'll most often hear this 3-star word mentioned during community events. So definitely listen out for it in scenarios involving charity runs, community volunteering, or fundraising for cancer research foundations. Rounding out our clinic visit is a massive 5-star word, effect. This is an essential logic word for your writing tasks. In a medical context, it's crucial because a Canadian pharmacist is legally required to verbally explain a drug's side effects to you when you pick up a prescription, but its utility goes way, way beyond just the pharmacy.
Let's see how this builds into an advanced argument. Using a sentence structure like, "We must consider the long-term effects of eating processed foods on public health," in your CELPIP writing task 2 instantly demonstrates your ability to argue complex social and health issues. You're using precise cause and effect vocabulary, which the graders love.
Section 3, Body Functions and Health Status, the Lifestyle. We've successfully exited the clinic, which brings us to our third and final act, how Canadians actually manage their long-term health, diet, and lifestyle balance. We're rounding out our core vocabulary list with 4 essential terms used heavily by dietitians and personal trainers. This section really reflects Canada's strong everyday fitness and wellness culture. We'll begin with metabolism. You're going to often encounter this 3-star word in advanced reading passages discussing things like aging, diet, and weight gain. Dietitians are constantly talking about how to boost a slow metabolism. Now, despite its slightly difficult spelling and pronunciation, it is absolutely crucial to recognize it when scanning a text. Following that is the 4-star word, nutrients. Health Canada's famous food guide is pretty much considered common knowledge locally, and it constantly emphasizes getting essential nutrients from a diverse variety of foods. This makes nutrients a staple vocabulary word for any exam discussions regarding child development, school lunches, or just general public health. Then we have muscle, a solid 3-star word. If you experience sore muscles from exercise, knowing that many Canadians use their workplace extended health benefits to pay for free physiotherapy is a fantastic cultural nugget. Let me tell you, dropping a detail like that into your spoken responses adds incredible authenticity to your English. And that brings us to unbalanced, a 4-star adjective that is honestly your ultimate wildcard. You can use it to diagnose the root cause of almost any societal problem in writing task 2. You can argue that an unbalanced diet causes chronic illness, or maybe that an unbalanced lifestyle causes workplace depression. It's just an incredibly versatile word. As we wrap up this explainer, prioritize your study sessions by these star ratings, focusing first on heavy hitters like chronic, medical, infection, and effect. But before you go, ask yourself this. How will you weave these medical terms into your very next practice test so that you don't just sound like a student, but you actually sound like a true local? Keep practicing, keep analyzing those contexts, and I'll see you in the next explainer.